Welcome. I'm Diane Carbo with Caregiver Relief, and today's topic, the struggle of seniors with medication costs, the role of Medicare, and emerging solutions. This is a critical issue affecting millions of seniors, the daunting challenge of affording medications. I realize this is an issue for many young people as well, so I want to explore the complexities of Medicare, their advantage, and the harsh reality of prescription costs. And I also have an emerging solution. I have found some very startling statistics. A recent study has shed light on a concerning trend among U.S. seniors. Despite being insured by Medicare, many are skipping or stretching their prescription medications due to costs. I want to delve into this more in detail. Now, first of all, I want to tell you that recent study is a bunch of hogwash, only because this is something that has been going on for decades and 30, 40 years, where seniors have had to choose between medications and life's essentials. So when I come into this and they're talking about this as if it's a new issue, it is not. In a survey of over 2,000 seniors aged 65 and older, it was found that roughly 20% of seniors are taking less medication than prescribed or not taking medication at all because of the cost. This alarming figure highlights the growing issue of medication affordability even among the insured elderly population. The study, led by a health policy professor, Stacy Ducette-Zena from Vanderbilt University, also revealed that seniors are eager to discuss medication costs with their doctors. Of course they are. They're all dying because they can't afford what they need, and the copays are also killing them when you're on a fixed income. In fact, nearly 90% said they would appreciate a tool used by the doctors to estimate medication prices, though concerns remain about the accuracy of these estimates. I was not surprised to learn that seniors are not taking their medications as directed. I have worked with seniors for many decades, and as I said before, this has been an ongoing issue. Our government policymakers were aware of these issues and they have ignored them. When seniors hit the dreaded donut hole and have to pay out of pocket for their medication, many choose to do without their medications. The high cost of drugs is often linked to copays and out of pocket expenses. But this isn't just a problem for the elderly. People of all ages, including those with private insurance, face many similar challenges, especially for the new patented drugs and even some generics. Out of pocket costs can be prohibitive. Though programs exist to help lower these costs, including Medicare programs and initiatives by private companies and drug manufacturers, the solution might require a more fundamental shift. As Dr. Adam Gaffney from Harvard Medical School points out, that we need a cultural change towards making all drugs free, and it's essential for systemic reform. And I will tell you, I have the solution that the doctor has recommended. And I'm going to show you later on in this audio cast how you get your medications for free. The struggle is real, but so is the call for change. There's a growing recognition that healthcare, including medication, should be a right and not a privilege. This study is a stark reminder of the need for comprehensive reform in our healthcare system. And I have seen our healthcare system deteriorate over the last 50 years of nursing. Let me explain how we have gotten here. In the United States, nearly 1 in 10 new prescriptions totaling $55 million were not picked up in 2020. The primary culprit? The high cost of medications, a phenomenon known as prescription abandonment. In the year before the pandemic, 13 million Americans faced a dire choice. They decided to forego their medication due to exorbitant costs. This isn't just a statistic, it's a nationwide crisis calling for urgent, affordable healthcare solutions. As a nurse with over 5 decades of experience, I've seen this struggle firsthand. Seniors juggle between paying for medications and avoiding the dreaded donut hole. The tactics vary. Some ask the doctor to double the amount of pills prescribed that they are prescribed throughout the year so that they can take only what's half of what's prescribed so they can stretch their medications out to avoid the dreaded donut hole. And I've seen doctors willingly do this. God bless them. We're stuck in a government rut and it's challenging. Many stop taking their medications, and the consequences are often dire, leading to hospitals and even preventable deaths. In fact, studies show there are 55,000 preventable deaths in the U.S. because of seniors stop taking their heart medications, their insulin, or their blood pressure medications. I want to explain to you why this has been going on for so long and why. One of the significant factors in this complex scenario is what they call the non interference clause in Medicare. Established under the Medicare Prescription Drug Improvement and Modernization Act of 2003, this clause prohibits Medicare from negotiating drug prices directly with pharmaceutical companies. The rationale was the competition among private Medicare Part D plans would lower costs. And again, this isn't a if this was not, it didn't work. However, this hasn't always led to cost-effective solutions for patients. Just like Obamacare did not lower healthcare costs, but it created a $1 billion insurance business of gatekeepers that deny, delay, and ration care. The high deductibles, the cost sharing with high copays, and out of pocket expenses is meant to deter the use of benefits. Now, let me explain about why drug costs have increased. Pharmacy benefit managers, or PBMs, play a pivotal role here. They act as intermediaries between insurers and pharmacies, negotiating drug prices. However, their role has become very controversial. Critics argue that the PBMs contribute to high drug costs through complex rebate arrangements and lack of transparency, affecting what patients ultimately pay at the pharmacy. The pharmacy industry has no transparency. There is no regular cost schedule. That is why you can see such varying prices for the very same medication. Unlike many countries, the U.S. lacks standardized pricing for medications. This leads to inconsistent and often exorbitant costs for the same drug. Various factors, including patent laws, market exclusivity, and the influence of pharmacy benefit managers, contributes to this inconsistency of drug pricing. As a result, Americans often face higher drug prices compared to other countries. Did you know that 30 years ago, medications were only a few pennies for every healthcare dollar spent? Today, that has increased to 35%. So every 35 cents of every healthcare dollar is being spent on medications. What has happened and what changed? The only thing that has changed is corporate greed. The high rate of prescription abandonment, often due to cost, has broader implications for patient health and overall healthcare spending. It's essential to understand that this is not just an individual issue, but a systemic one. As a society, we need to advocate for policy changes that promote increased transparency in drug pricing and hold pharmacy benefit managers accountable. I'm going to share with you my personal experience with medication costs that has been eye-opening. Years ago, a medication that was being costing me $500 a month was under workers' compensation. It was for terrible migraines I was having. It was Topramate. I was taking the generic form of it. When I was discharged off of workers' comp, the medication was suddenly just available to me for $5 out of pocket. The disparity of pricing was so shocking to me. It was a clear indicator of the greed within the pharmacy benefit manager system. Now I want to fast forward to my experience with Medicare. One change in medication led me to the dreaded donut hole. When you're choosing your Medicare Part D plan, you have to know what medications you're on, and then you have to look at formularies. And every level of formulary that you look at is a higher cost, monthly cost, so that they can provide you with medications that what they think or perceive as very high dollar medications. The cost for this medication, Duloxetine, was going to be $700 a month. I will tell you, Duloxetine is an SSRI, and I'll explain that in a minute. I was taking it, it's an antidepressant that is often used off label for pain management. And it was the one drug that was absolutely working for me. And because all my years of nursing, I have chronic pain. So even with the discount card, the price remained unaffordable at $500 a month. Like many seniors before me, I had to make the tough decision to stop the medication. Now, let me tell you, I was fully aware of the painful withdrawal symptoms that I might experience. Withdrawal from SSRIs can be brutal. Symptoms ranging from flu-like signs to psychological and sensory disturbances. It's a harsh reality for those abruptly stopping medications due to cost. And I can tell you, if I had been prepared and knew that this was coming, I would have worked out a system where I slowly weaned myself off. It was over the holidays and I couldn't get anybody to talk to me or help me in any way. And I went off them and it did. It was just a brutal withdrawal. Now I want to talk about pharmacy discount cards. They promise savings, yet often fall short. Investigations have shown that some customers end up paying more than even the cash price that they were promised. These cards, while marketed as helpful, may not always offer the best deals due to hidden costing and kickbacks and corporate greed. There are pharmacy discount cards that are not worth the paper they are printed on. And I can tell you, I've had several clients tell me they were expecting to pay one price as seen on the discount card app. And once they got to the pharmacy to pick up the medication, they were told it was going to be a very different price. To me, it's like a bait and switch thing that these companies are causing. I also want to address the new Medicare rule allowing for the negotiation of all medication, and it marks a significant shift in healthcare policy in the United States. According to the U.S. Department of Healthcare and Human Services, starting in 2023, Medicare began the process of negotiating directly with drug manufacturers to lower the prices of high-cost prescription drugs. And I can tell you, the manufacturers are not the ones that make the rates. They sell things for pennies on the dollar. It's the pharmacy benefits managers that change the rate of decide the price of the medication. This initiative is part of the implementation of the Inflation Reduction Act, IRA, which aims to reduce healthcare costs for seniors and people with disabilities. First, let me tell you, I am not impressed with this law at all. It gives the impression the government is doing something to address the high cost of medications. Let me put things in perspective for you. There are over 32,000 generic medications. I repeat, 32,000. When I learned that our government policymakers were starting to, with 10 medications, not only was I angry, but I was insulted. At that rate, we'll all be dead before any meaningful cut in medication costs comes through. The first 10 drugs selected for negotiation by Medicare was announced September 1, 2023, this year. These negotiations are set to occur. Oh, you can't make this stuff up. During 2023 and 2024, with the negotiated prices becoming effective in 2026. There's definitely no rush in helping the seniors or individuals with their medications. It's going to take 3 years for the government to implement cost cuts in 10 drugs. In response to this new rule, the Centers for Medicare and Medicaid Services, CMS, have released revised guidance on how the negotiation process will be conducted. This guidance includes details on selecting drugs for negotiation and outlines the considerations CMS will take into account during the negotiation process. These considerations include the clinical benefits of the drug, their role in fulfilling unmet medical needs, and their impact on Medicare beneficiaries, among other factors. The pharmacy industry's response to this, while they say it's varied, pharmaceutical companies have historically opposed such measures. And as soon as this started to happen, the big pharma started filing lawsuits saying that it was unacceptable to them because they're citing concerns about the impact on their profits for babies and the potential to hinder investment in research and development. You know what? I don't care about their profits anymore. The consequences myself and so many other people have experienced is unacceptable. However, the government's stance is that this move will enhance access to life-saving drugs at more affordable prices, thereby improving public health concerns. As I'm saying this, I'm rolling my eyes. I'm sorry. This is just insulting to me as a healthcare consumer. You can check out more detailed information about the Medicare Drug Price Negotiation Program, and you can visit the official CMS website. There is, however, a glimmer of hope. MyFreePharmacyPlan.org offers a different approach, a flat fee membership for prescription drugs. This is akin to the Netflix model. This is a game changer, especially those with chronic conditions like diabetes. In fact, when I read that Dr. Adam Gaffney from Harvard Medical School pointed out that we needed a cultural change towards making all drugs free, it's essential for systemic reform. I'm excited to share with you, I have a solution that is just what this doctor ordered. We don't have to wait for the government to take care of the issue of high cost of medication. The best part of the U.S. is the private sector. It always steps up when they see a need and try to provide a solution. Look what the Tunnel to Towers is doing. They're helping first responders of 9/11 and our police that are being killed on the streets. And we have Wounded Warrior Project. Our government drops the ball on healthcare and housing and treating our vets poorly when they come home. So there's this private sector always meets the needs when they see it. So the journey to affordable healthcare is ongoing. While we wait for policy changes, initiatives like MyFreePharmacyPlan.org offer immediate relief. It's about empowering you to prioritize your health without the burden of unmanageable costs. This revolutionary approach will forever change the way we purchase medication. Plan.org is an innovative program designed to help uninsured and underinsured individuals access medication at significantly reduced costs. The majority of them are for free. This initiative was created to combat the rising prices of prescription medications and ensure that people do not have to choose between their health and other essential needs. So here's how the plan works. It's a membership subscription. Individuals sign up for a monthly membership fee, similar to joining a gym or Netflix. This membership provides access to 800 of the program's medications, We have an extensive medication list, and members can search myfreepharmacyplan.org list of over 800 generic medications, which covers a wide range of commonly prescribed drugs for various health conditions. I love this because they have identified 90% of the most regularly prescribed medications and have made them free for one flat fee. That is why I see the 10 medications in 3 years before they implement the change. It just makes me on. It gives the perception that the government is going to help us when, in fact, they want to delay the decrease in the profits for the pharmacy benefits managers. These organizations have huge lobbying teams that support our government policymakers and ignore the needs of the U.S. citizens that elected them. So trust me, the harm they have caused to seniors and the underinsured is just devastating and unnecessary. MyFreePharmacyPlan.org also offers pharmacy coaching. The program offers a team of professionals that can assist members in reviewing their medication and ensuring they are included in the program and finding therapeutically similar alternatives if they can. There's the ease of prescription transfer and confirmation is very easy. Members can transfer their prescriptions to myfreepharmacyplan.org, or their doctor can e-prescribe directly to the service. The pharmacy team handles the transfer process and confirms the order with the member. Medication delivery. Chronic medications are shipped directly to the member's home for free, simplifying the process and ensuring accessibility, cost, and savings. The program targets generic medications, offering them at no additional cost to the member beyond the monthly subscription fee. For those taking brand name drugs, the program's pharmacists can help find equivalent generic drugs or provide brand name medications at contracted costs with over, I think it's 6,500 pharmacies. Over the counter medications are also offered at discounted rates. And if you have diabetes, that you will struggle. I can actually say that we offer the lowest prices of insulin in the country. Check us out. If I can't save you money on your medications, then you don't need me. I will let you know, though, there is immediate activation. Members can start using the benefits immediately for mail order prescription and within 24 hours for retail after signing up. There's also family coverage. A single person is $20 a month for free medications and greatly discounted over-the-counter medication. The family, we have one family that I know that has 9 kids, and they range from little itty bitty to teenagers. And these 9 kids are covered under one plan for $30 a month. Nationwide availability, the service is available in all 50 states, broadening its reach and accessibility. This program is particularly beneficial for those who find it challenging to afford their medications due to high insurance deductibles or lack of insurance coverage, or seniors that want to avoid the dreaded donut hole. MyFreePharmacyPlan.org represents a significant step towards addressing the issues of medication affordability and accessibility in the U.S. Now, it's important to note that this is not an insurance plan, but a subscription-based service aiming at reducing medication costs for individuals and families. For more detailed information and to explore the list of medications coverage, you can visit the myfreepharmacyplan.org website. Thanks for joining me today, and I hope this discussion has shed light on the critical issue of medication costs for seniors and others and the emerging solutions we have. Remember, your health is priceless. I'm Diane Carbo, and this is with Caregiver Relief.